Hi everybody, my name is Caroline Baber and I'm a third-year medical student at Western UConn Northwest, and I'm here today to talk to you all about my project titled The Effects of COVID-19 on the Mental Health of First Responders, a review of the Lebanon Fire Department. I think we can all agree that since January 2020, when COVID began showing up in the United States, we've had to change the way that we live our lives. From donning PPE to social distancing to virtual workplaces, we've all been impacted by this pandemic. However, those working on the front lines have been particularly impacted. Because of this, I wanted to do a study that looked at mental health among first responders, and I decided to use the Lebanon Fire Department as a case study for this. So, using the GAD-7 or Generalized Anxiety Disorder 7 and PHQ-2 or Patient Health Questionnaire 2 screening tools for depression and anxiety, I decided to ask full-time paramedics, EMTs, and firefighters to assess their mental health, both pre-pandemic, so noted as before February 2020, and post-pandemic, which was collected in November 2020. In addition to collecting GAD-7 and PHQ-2 scores, I also collected information on whether or not participants participated in deliberate wellness activities or had any sort of previous mental health diagnoses. And from this data, I found that the average anxiety level increased significantly from 1.8 correlating to a clinical anxiety level of mild to 4.9, which correlates to a clinical anxiety level of moderate. For 11 of the 13 individuals assessed in this study, GAD-7 scores increased, with the most significant being increase from 0 or no anxiety to a GAD-7 score of 15, corresponding to severe anxiety. I also find a minor increase in depression levels going from 0 to 1.3, but this correlates to no depression on the PHQ-2 screening tool, so this is not clinically significant. In addition to this, I found that those participating in deliberate wellness activities such as counseling, support groups, and exercise had smaller increases in GAD-7 scores pre versus post-pandemic compared to those who did not. And this information is really important because we know that depression and anxiety have significant impacts on the overall health of those affected, correlating to lower life expectancies and poor physical health outcomes. Therefore, it's essential that we not only assess first responders to see their mental health status and how they're being impacted, as well as provide resources to help mitigate this burden, including counseling, exercise, support groups, etc. Lastly, I would just like to thank everybody that helped me out with this project, and I hope you guys enjoyed this presentation. Thank you.